Despite the climate of fear created by our politicians, the fact is that the healthcare sector is still growing like a weed. That's one of the things our leaders keep complaining about. Despite its flaws, the Affordable Care Act has been very good about getting more people health insurance, and that's led to a pretty dramatic increase in medical spending. So if you're looking for a creative way to play this business that might be more immune to political grandstanding, I mean, it is Super Tuesday, than the rest of the healthcare cohort, you might want to consider AMN Healthcare Services. That's AHS for you home gamers. This company is what's known as a managed service provider, or MSP, type of healthcare cost containment play where hospitals basically let AMN use its expertise to manage the business side of things so that they can focus on treating patients. AMN serves thousands of hospitals, clinics, medical centers, government facilities, and other healthcare organizations, including some really big-name ones, Stanford, New York Presbyterian, big outfits. Now, after a gigantic multi-year run, this stock has pulled back roughly 23% from its highs last September, and I like a lot of other stocks. But AMN blew away the numbers when it reported less than 2 weeks ago. Stock then seems to have started its rebound. Doesn't have more to run. Let's dig deeper with Susan Salko, the president and CEO of AMN Healthcare Services, find out more about the company and where it's headed. Ms. Salko, welcome back to Mad Money. Good to see you. Have a seat.
Always a pleasure.
Every time I talk to you, I find that there is a new shortage in healthcare. In your excellent conference call, you talk about one involving 9,000 nurses that you quizzed, 54 or older and starting to retire.
Yeah.
Where you're going to find nurses for people.
Well, you know, the shortage of clinicians spans all disciplines. It's not just nurses. Physicians, in fact, about a third of physicians are 60 or older. So a good majority of them are going to begin to retire. And we don't have enough new physicians coming into the market. But on the nursing side, about half of nurses are 50 or older. And in that survey, they asked nurses at 54, are you going to retire? And 2/3 of them said absolutely and likely within the next 3 years.
Well, can I just ask you, I mean, we always hear about that there's these professions where people can't get jobs. I mean, they're watching and say, well, I'm unemployed. I mean, every single one of your categories needs more people, and they're not all just people who are doctors.
Yeah, you know, it's really been an amazing burst that we've seen in demand. And it's not surprising because of the shortages, and we're really just at the beginning, I think, of early innings of all of these shortages. But you also have other factors. You know, really step back and look at the major factors that drive utilization and demand for our services. The economy is absolutely a factor. In fact, it drives more vacancies, more job quits. We're at one of the highest gaps between job openings and job hires within healthcare today. And that means that our clients are having challenges in hiring not only temporary but permanent staff. So we come in with a suite of workforce solutions to really help them all across that spectrum.
Well, let's talk about that because I thought this is Dan White, president, said on a conference call, a couple ones, just to give you some color around our strategic accounts. Look at our top 20 accounts. 25% of them now utilize 5 more of our offerings. So you get in with one, and then you end up doing all the rest?
Absolutely. We really try to look for multiple ways to help our clients across their spectrum. You know, it's and how we can help them to recruit clinicians, onboard, credential, train, and then optimize that workforce. You look at some of our recent acquisitions of Avantis last year. That was to help our clients to better optimize the workforce they have, whether it be temporary or permanent. And then more recently, the acquisition of B.E. Smith.
Which was almost immediately additive, right?
Absolutely. It's not only immediately additive to the types of services, but it really hits an important pain point for our clients. One of the biggest complaints that we've heard from clients is we can't do the transformative work we need to do in healthcare because we don't have enough leaders. And so we acquired the largest provider of interim and permanent placement for healthcare executives. And in fact, last year, we also acquired the First String and Milliken Solutions, which also provide healthcare leadership.
Now, one of the things that was a constant theme through some of the questions, I think the analysts are always trying to poke holes, but they were trying to figure out a scenario where you wouldn't do well, where if the economy were slack. And it does seem like at a certain point, if there was, if everybody could find a job, they wouldn't necessarily need you. But it seems like that there are verticals within your company that are always going to be in demand that you just can't do yourself.
You know, you have to remember, again, we have multiple drivers within the business. And it's, yes, the economy. There's a correlation between GDP and unemployment. And as unemployment is low, it typically drives demand for services in our business. But that's not the only factor. Again, you have this aging population, which is going to continue to create challenges. So we've worked very hard to continue to diversify the business and make sure that we're adding on workforce solutions that can really help our clients across that spectrum. spectrum, and they tend to be less economically sensitive and have higher margins, which is why you've also seen improvement in our EBITDA margins over the years.
Yeah, I saw it's just going right up. There's a great chart in the back. Then you call out the physician permanent placement business knocked the ball out of the park. Is there a particular reason why that division was so strong?
Well, we have a phenomenal team led by the founder, Jim Merritt, and Mark Smith, our president there, and they've really worked hard to continue to diversify the business and build upon it over time. And they've done a great job of taking those services into the large systems. Consolidation has been good for us.
Right, that's another theme that has been really terrific.
And so, you know, they've just really are hitting on all cylinders and making sure that they're evolving their business to continue to change with the needs of our clients.
Well, I think this is an example, again, of the overall market going down and then the individual stocks that are of the companies that are doing well coming right back, and that's one of them is yours. That's Susan Salka, the president and CEO of AMN Healthcare Services. This is the right time for this stock. Stick with Cramer. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.